Hello, and welcome back to the ASCO Journal of Oncology Practice podcast. This is Dr. Nathan Pinnell, medical oncologist at the Cleveland Clinic and consultant editor for the journal. To quote one of my guests today, cancer care is a journey along the continuum of care, starting with risk reduction and cancer screening, moving through diagnosis and treatment, and continuing through survivorship. Managing patients along this continuum involves multiple healthcare providers, from the primary care provider who's counseling the patient about their screening, to the radiologist reading a mammogram, to the oncologist or the surgeon who's actually treating the cancer. Patients expect that this process will happen smoothly and that their providers will work together as a team. But as it turns out, this type of coordination doesn't just happen naturally. Today, on this topic, we'll be discussing two papers, both published ahead of print this April in the JOP. Reviewing Cancer Care Team Effectiveness and Teams and Teamwork During a Cancer Diagnosis, Interdependency Within and Between Teams. Joining me today are several of the authors on these papers. Dr. Stephen Taplin is the Deputy Associate Director of the National Cancer Institute's Healthcare Delivery Research Program. Welcome, Dr. Taplin.
Hello, glad to be here.
Next, we have Veronica Chalet, Program Director in the Health Systems and Interventions Research Branch of the Healthcare Delivery Research Program at the NCI. Ms. Chalet, thank you for joining us.
Thank you for having me.
And also joining us is Dr. Michael Costi, who is a practicing hematologist and medical oncologist at the Scripps Clinic in La Jolla, California. Dr. Costi is a fellow of the American Society of Clinical Oncology and will serve as the incoming chair of ASCO's Workforce Advisory Group. Welcome as well, Dr. Costi.
Nathan, glad to be here. Thank you for having us.
Since we're getting on the topic of teams, can we start just by defining the term? I think many of us as oncology providers already think of ourselves as being members of a team with the physicians and extenders that we work with. So what exactly do you mean when you're distinguishing a group from a team?
Well, that's an excellent question, Dr. Pinnell, and you're right. Many practitioners do believe that they are members of healthcare teams. However, in the practice of healthcare delivery, distinguishing groups from teams is very important, as both are characterized by distinct behaviors, which we believe lead to different outcomes. So to define groups, they are defined as two or more people who contribute to a common product and perform their own work relatively independent of each other. And teams, however, are defined as two or more people who interact dynamically, interdependently, and adaptively to achieve a common and valued goal.
So where did this whole idea come from that teamwork improves outcomes? It sort of makes sense, but is there evidence that focusing on teamwork as a formal concept makes a difference?
Yes, there are several links between teamwork and outcomes that have been established in a high number of high reliability organizations where the consequences of errors are high, but the occurrence of error is extremely low, such as in the aviation as well as the rail industry. And there is long-standing and established literature in this area. And there's also a long-standing emphasis in numerous reports, policy documents, as well as healthcare literature that spans quite a few decades on the effectiveness of teams in healthcare to improve patient outcomes. And there have been several models also for team-based care that have been shown to improve outcomes for patients with chronic conditions like hypertension and diabetes management. But unfortunately, little progress exists in the literature relative to teams in cancer care.
Now, this is Steve Taplin. I just wanted to, Veronica's exactly right. I think that was really part of the motivation was that the evidence around teams in cancer care was perceived to be potentially thin. We didn't really know completely how much information had been done in cancer specifically, and so that was part of the motivation for this paper.
No, that makes perfect sense. I understand that there's a new National Cancer Institute and ASCO collaboration who is taking this particular topic very seriously and trying to work together to explore the application of evidence for team effectiveness in practice. So how is that going to work?
So published in the Journal of Oncology Practice were really two papers, one looking at the literature which exists in cancer care team effectiveness, and a second paper based on a vignette discussing the importance of delivering cancer care as a team. These manuscripts really mark the beginning of a collaboration of the National Cancer Institute and the American Society of Clinical Oncology to bring clinicians, patient advocates, and researchers together to explore the application of the evidence of team-based effectiveness to clinical practice. This NCI ASCO collaboration will ultimately unfold at a workshop scheduled in 2016.
That's great, and I understand there's going to be a series of publications. Is that going to happen throughout the year, or are these going to be arising from the workshop next year?
Yes, so also published in the Journal of Oncology Practice and on the ASCO website at asco.org/teams is a call for participation. The goal of this really is to illustrate in presentations and manuscripts effective approaches to delivering coordinated patient-centered cancer care and apply the evidence which exists for effective cancer care teams. And the hope, I think, is to ultimately develop a list of questions which would benefit from further research. And so we're actually soliciting 10 writing groups composed of clinicians across the spectrum, so physicians, advanced practice providers, nurses, patient advocates, and then most importantly, researchers with expertise in the science of teams, putting these folks together to function as a team, as Veronica described earlier, and ultimately end up with a paper which will be published and then presented at this workshop in 2016.
No, I can see how this could raise a lot of excitement in the oncology community. It really makes sense, and it fits well with the efforts towards moving towards value-based care in the United States. I can say that here at the Cleveland Clinic, when these papers came out ahead of print, I immediately got an email from my chairman about a number of department members potentially applying to be one of the writing team. So I'm sure that's happening all over the country.
We hope that's happening all over the country.
So when we talk about the actual research that goes behind this, can we talk a little bit about the first of the papers here, reviewing cancer care team effectiveness? Can you take me through that a little bit?
The first paper was to systematically look at what we already knew about teams in cancer care. So we looked systematically across the cancer care continuum. We defined teams broadly and wanted all teams that were contributing to a patient's cancer care. So that was from screening through to the end of life. And so any place in that continuum was eligible. However, we did concentrate and find most of the work in what we called multidisciplinary care teams, which were composed of people who were specifically trained in oncology and had depth in oncologic treatment. And that turned out to be the place where most studies were developed. We had some specific criteria for the teams that we would include. They included people, the papers that we included had to specifically define who was on the team, have a comparator group against which they were comparing their outcomes and their function, and have a patient-centered outcome of some sort, so a specific patient metric like satisfaction or survival or quality, some quality metric of their care. So we had that systematic look. We ended up with 16 studies and a reasonable amount of information supported, though not necessarily that high quality, meaning there was only one or two randomized trials within all of the work that we did. Most of it were time series and comparator observational kinds of studies.
Were you surprised that there were so few randomized trials in this topic?
Not really. It's pretty hard to do that kind of a study in clinical practice. I think given the amount of rhetoric around teams, though, that was maybe a little surprising, that the fact that there weren't that many randomized trials, though there has been a lot of rhetoric that we do practice in teams and should practice in teams. So I think the discord between the amount of evidence in randomized trials and the amount of talk about teams was surprising to me, and was also part of the motivation.
No, that makes sense. So what kind of benefits did you actually find in your review?
Well, we did see changes and improvements in patient satisfaction there was quite a bit of work demonstrating that multidisciplinary care teams improved preparation for treatment and actual delivery of treatment. There was some work showing that specific compounds had higher adherence when a team, including a pharmacist, was associated with them. So there was some good evidence that teams actually did affect patient outcomes.
No, those are obviously very meaningful. I just wonder if one of the reasons there aren't more randomized trials or strict studies is it seems as though the benefits are relatively self-evident here. And you seem to have verified that through the limited amount of studies you were able to find. Do you think we can say that teamwork is beneficial and just go ahead and accept that and move towards implementing this, or are we going to need to study this more?
I think we need to study it more. What we didn't see was any information about what exactly was part of a team that made a team work and improve function. So there's a lot of talk about teams, but what are the kinds of things that people need to do together to actually optimize their functioning? I think as we face pressure, the number of people that can be involved and the activities that they should undertake needs to be studied in order to optimize their functioning. Go ahead.
I think that, clinics and clinicians providing oncology care, I think, believe they already practice as a team. And I think patients have this expectation that as their care is involving more and more individuals across their care continuum, that these transitions will occur seamlessly and that communication goes on behind the scenes. And I think that as the other paper, the clinical vignette, I think nicely demonstrates that there are many potential places where things can fall through the cracks and where the care delivery system as currently structured in many places really is not functioning as a team. So I think that patients are often left with the responsibility of actually coordinating their care. And so I think one of the things we're trying to look at through this series of vignettes is could we improve quality, access to care, efficiency, clinical outcomes? Are there roles that the patient should really be expected to have as part of the team? And if are the clinicians involved embracing the role of a team, or are they trying to function largely as individuals? So I think through the series of vignettes and looking at specific aspects of the care continuum and specific principles of teamwork, I think we'll explore these issues and maybe come up with some answers that would be broadly applicable to cancer care in general.
I agree with Mike. I think that there also are, with the changes in the reimbursement and the Affordable Care Act, there also are incentives to do this more consciously as well. And I think the issue of value is part of it, but it's also the creation of things like the patient-centered medical home, which is now also coming to oncology, and accountable care organizations are structures in which really reimburse or are trying to reimburse value and to some extent coordination. And so the conscious attention to what's going on in that group is part of what we tried to portray in the second article about teams and teamwork during a cancer care diagnosis, that if you don't consciously think about the connections between the work you're doing, it doesn't get done as efficiently.
Yeah, I think this team-based approach really has the potential to leverage all the issues that Steve just mentioned and provide an opportunity for each of us to re-examine our roles and responsibilities in the care of patients and as members of the team, and really to enable the most efficient delivery of high-quality healthcare services. As everyone knows, the delivery of oncology care is facing a potential crisis from a workforce perspective in terms of not having enough providers for an aging population, treatments which are allowing patients to live longer. And so I think we not only want to work better, I think we need to work smarter and more efficiently, and that's where I think the team science can really help the delivery of healthcare.
And do you think this makes a lot of sense when we talk about some of the relatively disconnected practitioners, the primary care doctor working with the radiologist or communicating with the treatment team? Do you think this initiative also has benefits to more formally existing teams, things like the multidisciplinary teams? So I personally work as part of a multidisciplinary lung cancer treatment team, and so a lot of this really resonates with what we've been trying to do here. But when we interact with outside health systems, when we interact with even trying to expand the reach of some of our care metrics and care paths with our health system outside of our main hospital, we're already starting to see a little bit more of a difficulty when we're trying to entice members to think of themselves as a member of our team.
Yeah, I think one of the key pieces that from outside of medicine is about shared goals. And so I think sometimes we assume that we have a shared goal of taking care of people, but I'm not sure that that's always what we mean by taking care of people. May mean doing our particular part of the job and not thinking about the care of the person as a whole. So I think part of the issue in some of that work and some that comes out of the teamwork is the need to, what establishes a team is a common goal, as Veronica said, having a common goal that they all value. So I think some of these discussions start in the middle of the care process as opposed to maybe stepping out of the care process and talking about if you're going to assume a new group and you want to work together, you have to have a team. That means you have to have a shared goal. So maybe stepping away from the immediate care process, this may open up the need to be clear about what our goals are. What are we trying to do together? And then what part do I do? What part do you do? What part do we have to do together? It's really, some of it's not really rocket science. It's just sort of important, conscious stuff to do. In the same way that football isn't rocket science, but they don't get it done by just going out and playing. They do it by being coached and by practicing. And I think we in medicine need to begin to think about seeking some of those same kinds of assistance and conscious game plans.
Yeah, I thought that was very interesting in the paper when you mentioned talking about the importance of coaching and reinforcement. So you can mention this and maybe set up a framework for a team, but is this something that can be self-perpetuating without someone teaching people how to do this properly and making sure that they're following up on it?
I think it's a good question. I think it definitely is something that benefits from coaching, and there is the Agency for Healthcare Research and Quality has created a Team Steps, which does coaching. They do coaching now in primary care primarily. They haven't done a cancer care module, but there are certainly principles in what they're doing that would apply to the cancer setting. So we've talked with them a little bit, and I'm sure that more people asking them about it could inspire them to, and certainly they would be open to working with anybody who asks them or wants to come to their training. So I think coaching is a really important part of it. We have stuff that we do in the heat of care that we just get used to doing, and it may need somebody outside to examine it.
Well, and I think the literature in healthcare and other fields demonstrates that really effective teamwork takes time and really an intentional focus. You have to develop, nurture, and really create the right environment, and that may include having people with expertise in how teams function participate, and then obviously once that ball is rolling, it's another thing to try to sustain it. So I think at many institutions, including yours, Nathan, and mine, cancer has led the way in one respect in having multidisciplinary teams, but I think one of the challenges that I think you could demonstrate in your lung cancer multidisciplinary team is not only getting people through the the treatment process, but then ensuring that there's kind of a smooth transition to the appropriate follow-up and ultimate survivorship care, which may be well established in some institutions and less well established in others. And so I think that there's opportunity even in those settings where care is practiced at the highest level in terms of true integration and true multidisciplinary teams. There's always opportunity for improvement.
And I think there's lots of opportunities as patients enter and leave the system as well. So once they enter our multidisciplinary team, I think we take pretty good care of them through the end of their treatment. But if they're not part of our health system, they may go back to their primary care provider in a completely different health system. And I think it's important that that person, that primary care provider, think of themselves as a member of our team as well. I can see how that could be challenging.
It definitely is. So I'm a primary care provider. That's my experience and that's my background. I completely agree. And I think that's where in the teams and teamwork during a cancer diagnosis was really to bring up that issue that there really can be several teams involved in somebody's care. And part of what has to happen to create the Uber team that a patient sees is for those people to communicate with each other. So I think the accountable care organization is part of the incentive, but ultimately I think patients are going to demand that we are communicating more clearly. And I think the information technology opens up the possibility that we can improve things that way. And to me, that's one of the big challenges is how do we make the connections between the sub-teams that compose the big team that is taking care of these people. And that means not only communication, but it also means establishing common goals. And the intentional practice that Mike was talking about.
And I think one of the challenges is in many settings, these multidisciplinary teams, the roles are sort of assumed or implied and maybe not explicitly spelled out as they might be. And I think, Nathan, your point about patients entering or exiting a particular team at varying points in their diagnosis to survivorship continuum is an important one because if you receive excellent care in the early stages of the disease continuum and then things fall apart subsequently, I don't think we've done the best job we could have for that patient.
No, that makes good sense. So hopefully our listeners, having now listened to this podcast, are excited to take part in the NCI ASCO initiative. So can we just reinforce for them, what do they have to do if they want to become involved in this?
So we have applications available online. It's asco.org/teams. And the applications are due June 15th. Teams will be selected July 17th, and we have an in-person face-to-face meeting in late August 28th. Again, this is open to individuals or preformed groups consisting of clinicians, patient advocates, and team science researchers. Those who apply as individuals, the application process is very easy and relatively painless. The editorial group of this project will get together and assemble teams, and those individuals will be notified of their status by July 17th. But I think it's an exciting opportunity for individuals across the spectrum of care and those involved in team science research to really collaborate and advance all the issues of patient care and delivery of medical care that we've been talking about on this podcast.
And if anyone has questions, they can email us at teams@asco.org.
Oh, that's great. That's wonderful. So I think we have covered things pretty well. This is such a great topic. We could talk about this for an hour, I'm sure. Is there anything that you want to make sure that we make into the into the podcast that we haven't talked about?
I just want to say that based on our 2 manuscripts published in JOP and the accompanying evidence-based citations, we just hope that they shed light on the fact that there is a science to teamwork and that science has produced useful and effective and implementable guidelines and principles, and we hope that more clinicians and practices use that science of teamwork to guide their interrelated patient-centered care within their practices and in their organizations.
All right. Well, thank all of you so much for joining me today and having this conversation about teams and team building.
Nathan, thank you. It's been a pleasure.
Having us.
Thank you. Yeah, Nathan, I just wanted to add, too, that I think it's really been a pleasure for us at NCI to work with ASCO. I think it's been a very productive collaboration. I think we have all benefited.
And I'm sure that's going to continue over the next year. So I also want to thank the listeners who joined us for this podcast. The full text of both papers, as well as an accompanying editorial, is available at jop.ascopubs.org under Early Release, and scroll down to April 14th, 2015. Don't forget, you can also read the JOP and access these podcasts on your smartphone or tablet with the ASCO Journal's mobile app, available at the iTunes Store and Google Play. This is Dr. Nathan Pinnell for the Journal of Oncology Practice, signing off. Thank you for listening.